All right, so this next organization is dear to my heart. When I first started in my role, I was pointed to this direction by John Wabb, the Canadian Center of Occupational Health and Safety was a resource I used to find answers that I couldn't get at the workplace. That's why I wanted to make sure I had invited them to our conference. So we have Riane Mars is an occupational health and safety specialist at the Canadian Center for Occupational Health and Safety. Riane provides a workplace health and safety guidance to employers, workers, and the public on topics like psychological health, ergonomics, and women's. She is part of the team that researches, writes, and reviews fact sheets and courses and supports the development of CCOHS suite of mental health web tools like Guarding Minds at Work, psychologically safe leader assessment, psychologically safe teams assessment. Riane is a Canadian registered safety professional and received a Bachelor of Science in Kinesiology from Queen's University. She has a postgraduate diploma in Occupational Health Safety Management from Western University. Riane is currently working towards her MBA with a focus in health safety leadership from the University of Fredericton. Also, we have Sue Freeman, is the Outreach Program Manager at the Canadian Center for Occupational Health and Safety. For many years, Sue has acted as a champion and advocate for mentally healthy and positive workplaces. She used her research in emotional intelligence and positive psychology to facilitate workshops on creating healthy and inclusive workplaces to help create work policies and procedures for the center. Sue has a Master's of Science Marketing from the London School of Business and Finance and the University of Wales, Cardiff. Her graduate thesis focused on social marketing campaigns, help promote both community and workplace health and safety. Sue also granted postgraduate certificates in positive psychology and positive education from Center for the Public Safety and Wellbeing at Laurier University. All right, welcome.
Bring greetings from the Center, Canadian Center for Occupational Health and Safety. I'm so very pleased to be here with Riane today. We're co-presenting at the Kindness Conference. Can it get any better than that, right? And we were greeted with kindness with David and Janice and Carrie. You know, we just slide in here, found some great parking. Awesome. We're also part of a union ourselves, Public Safety Alliance of Canada, and we're the Union of National Employees Representatives, and we're local 394 out of Hamilton, our employer being the Canadian Centre. My husband also brings greetings. He said, "Oh, don't embarrass me." I said, "Yeah, I will, because you're IBEW." Y'all know the room goes quiet for a second. I know. I've already had that chat. There you go, so you know. And he's Hamilton Local 105. He just got home from Go Gamma. He was up 29 hours. I think he had a couple hours sleep on a bus. So he brings his greetings as well, because he very much an advocate too of health, safety, and well-being. So a little bit more about the center. It's, I guess, over 45 years now. It was part of an act of parliament, and it was incepted around 1978. Been there about 24 years myself, and Riane has been there a few years now already. Yes, it's wonderful. We collaborate and engage with stakeholders all throughout Canada, including Ontario. WSIB, we're hearing from them today. OCAL, very big partner of ours. We've collaborated for well over a decade on apps, websites, occupational disease, prevention, all kinds of things come to mind. We're governed by a council of governors, and we just had a forum that we hosted nationally in Halifax, and that's the governor's event, as it were. And we were really focused on the changing world of work again. We hadn't been out on the road in a number of years since COVID and a pandemic and whatnot, but we were able to host again, had about 240 people. And what we're trying to do with that is have federal, provincial, territorial. We're having unions and labor representation, employers and government join us in a room And it was just one big plenary, and we went at it for 2 days. So I see some parallels here with the kind of work that you're trying to achieve. So just to give you a little bit of background, and then what the screen then says, how we're promoting, informing, and providing, right? So CCOHS.ca, en français, CCHST.ca. If you go on our website, there is such a wealth of information that you shall find. You shall also find it, shameless plug, brackets, in the room adjacent where other people have set up their materials. We brought some today. Thank you for affording us a table. Freely available materials, help yourself, bilingual, on subjects that we're talking about today, including an update from the International Labor Organization. They did a report back in 22. And this is a really important piece because it's talking about what the theme of your conference is today, about kindness, inclusion, diversity, equity. I'm seeing t-shirts on people. I had the benefit of being at the back there for a few minutes, and they're saying, you know, human rights need to be considered, defended, and actually be managed. So in terms of how the report survey found that only half of respondents said that diversity and inclusion were sufficiently identified and resourced in their workplace is quite alarming to me. I imagine it would be to you. So thinking about how the COVID-19 pandemic, they went on to say, exposed and exacerbated existing inequities in our economies and societies, which also means our workplaces, right? And a lot of essential work went on, including yourselves, because things couldn't physically wholesale stop. So considering all that, we're still in this period what they considered looking at resilience and recovery. So this is coming from the director of the International Labor Organization on the conditions of work and equality department. So that's a pretty specific bunch of work that they're doing there, which aligns with what you want to achieve too. So when we talk about how human rights and work works together, we're talking about an intersection. And you want to be able to build that back in. It was referenced very kindly in our bios about how we work on creating policies and procedures for our own organizations, but it's also about how they take place in the workplace. So there's an obligation to adjust rules and policies and procedures to be as inclusive as possible. And you think about having people be accommodated. And we heard a question earlier about mental health and how that has become a big part and theme of your actual conference. So you talk about undue hardship. It's like every reasonable effort short of undue hardship, which is a pretty high ceiling to my understanding under the law. Not being a lawyer, but that it would have to be some very devastating effect on the workplace not to be able to help somebody get what they need to work effectively and feel included. So this comes right from our websites. If you actually just said CCOHS, human rights in the workplace, or human rights legislation, or whatnot, it would pop up in the Google search, or go to the website itself. And when we talk about addressing it in terms of bias, things like unconscious bias or lateral violence, they're somewhat fancy terms for things like we're not getting along, we're not seeing each other's perspective, we're being disrespectful. So we brought materials about that today, and Ryan's going to touch on that more. And near the end, I'm going to talk a little bit about how well we actually relate to each other. So what does this have to do with occupational health and safety? Every single person that works in Canada, whatnot, but we'll focus on Canada, deserves a psychologically and physically safe workplace. It doesn't matter what you do. So in this scenario, we have this from one of our actual health and safety reports, a newsletter we produce. So Kwame works on the custodial team of a local community center. And one of his coworkers has been making disparaging comments about people who are immigrants, knowing that Kwame and his family are new to Canada. So that makes Kwame feel anxious and like an outsider. So there's the lack of inclusion, right? Not respecting the diversity or the equity. He avoids the coworker as much as possible. He doesn't feel psychologically safe at work. So if you can put yourself into the boots, shoes, or whatever. Maybe if you're on the job site, you'd have your proper boots on. As to how that would play out over time, if it's not just that individual, is it a team of individuals? And the promotion of this and training people. This is part of your work, I imagine, these next couple of days, is having dialogue around and discussing how, because you're going to be advocating and you're going to be leading, in a way, sometimes your own employers to a different place because you have vested interests in health, safety, and well-being in your workplaces. So we're trying to paint you a picture here that there's nothing that's like really pulled apart. Everything is together and whole, including the people that you're representing, however and whomever, right? So it's high time. We're having a lot of various conflicts in the world. We all watch some form of news, I'm sure, and you have within your own power, your own roles that you play in representation. So we just wanted to point out a few factors, and again, many resources that you can bring to talks with committees, health and safety, wellness, but I'll backtrack a bit. Is there an actual diversity, inclusion, equity type committee that your workplaces have? Are you aware of that? Any show of hands to that? Okay, we're seeing a few. So those of you who are curious about that, you can talk to those people because they're already down that road and they're already making some of these moves and might have advice for you on how that can be enacted in your workplace. So I'm going to pass it over to Ryan. There's the clicker right there. I'll just see my job.
Thank you. A little bit taller. Okay. So thank you, Sue, for that. And speaking about psychological health and safety and how are we going to incorporate that into our traditional health and safety programs and really work to create a healthy and safe workplace. Okay. So when we think of health and safety, we often think about the physical, chemical, and safety hazards in our work environment. And we're looking for hazards that can hurt us. And when we're thinking of health hazards, we're often looking at it from an occupational disease prevention perspective. So we need to be able to move past that physical side of injury prevention and to have a complete and comprehensive approach. Workplaces should consider measures that may impact the mental health of the worker as well. So this means we need to consider psychological health and safety just as much as we consider traditional health and safety. So what is a psychologically safe and healthy workplace? Well, the CSA standard Z1003 defines a psychologically healthy and safe workplace as a workplace that promotes workers' psychological well-being and actively works to prevent harm to psychological health in negligent, reckless, or intentional ways. So in other words, a psychologically healthy and safe workplace strives to make sure that the work we do does not cause physical or psychological harm. And there's two really important elements and concepts within that definition. The first is to protect the mental health of employees, and that's at the organizational level, and we're preventing harm. And then the next is promote. So we are promoting the mental health of workers, and we do that by providing support at the individual level. So we understand that preventing harm moves beyond physical injuries to include psychological injuries as well. But what are the challenges? So similar to any new initiative in your workplace, there may be considerations for resource allocation, perhaps some resistance to change, lack of knowledge, or competing priorities. And then the biggest thing that we hear often is, where do I start? How do I incorporate this into it? So starting your workplace journey into psychological health and safety doesn't need to be intimidating, and we can apply a lot of the same principles that we would for traditional health and safety into a psychologically healthy and safe workplace, like using the RACE model. So as health and safety leaders and workplace representatives, we can participate by identifying and including psychological hazards into our hazard and risk assessments that we may not have considered before. So RACE stands for Recognize, Assess, Control, and Evaluate, and it's a cyclical model that a lot of health and safety programs are already based on. So we're going to go through this model fairly quickly of how we can apply it to psychological health and safety. But first, it's really important to remember as we're going through and speaking to workers and going to the workplace to assess and recognize these hazards, that we're not looking for mental health issues. It's not about that. It's about how work can impact our mental health. So it's important that we focus on the organization and not the individual. So before anything, we need to recognize that psychological health and safety is part of our overall health and safety, and it's something that workplaces need to do. We can build a business case by taking absenteeism data, turnover data, employee feedback, compliance to legal requirements, and then also looking at what you already have in place. It's likely that you have programs, information, policies, and supports available within the workplace that just need to be pulled together and reframed in a new way. So we also need ownership and support from the top. Like any initiative, upper management support is necessary, but we can do this by having a joint labor and management committee where you become the spokespeople for change and leaders of the program and the initiative. And this is really going to help get support from everyone, because everyone needs to buy into this program and know that it's something that's important that we need to keep doing for it to be successful. So next, moving on to assess. In this step, we identify and assess psychological hazards in the workplace. We can do this by reviewing injury statistics, investigation reports. We can also look at the use of benefits and employee assistance programs, conduct workplace audits, and have discussion groups, and also using some of the survey tools like were mentioned earlier, like Guarding Minds at Work. Throughout this process, you're going to be looking for trends and psychosocial hazards. Listen to the feedback from coworkers, employees, and pull themes that affect teams and groups within the organization. So next, control. Like traditional safety hazards, we can apply the hierarchy of controls. So that's the elimination, substitution, engineering, administrative, and PPE. So determining effective and practical controls may seem challenging for psychological hazards and may require a bit more creativity, but it's definitely possible. And a lot of them will be administrative in nature, and that's okay. We can look at administrative controls and break them down further into organizational controls and then individual controls, where the organizational controls is really focusing at the source, and then the individual ones is more at the worker level. So incorporate these controls into a plan and communicate along the way. And it's very important that throughout this entire process, you're having those conversations and letting people know how it's going. So once your plan is in action, your controls are in place, we want to continue to monitor and update the program just like any other health and safety or traditional health and safety program. And always know that there is room for change, there's room for improvement for short-term and long-term goals, and it's okay to modify along the way, just as long as we're communicating that as well. Okay, so jumping back very quickly, I did mention the CSA standard, and we're gonna speak to the psychosocial risk factors for a few slides. There are 13 of them, and they are going to be very helpful when you're looking for trends as you assess psychological health and safety in your workplace. So these are the 13 psychosocial factors identified within the standard. And these workplace factors can impact work positively and negatively. So please take a moment, look through the list. Is there any that really stand out to you that relate to your workplace? And you can think about what your workplace does really well and something that maybe can be improved upon. So I have highlighted 2 here, starting with organizational culture. Organizational culture is characterized by trust, honesty, and fairness. And in general, it's the basic assumptions that are held by a particular group, and they could be beliefs, values, meanings, and expectations that group members hold in common, and they use as cues to act in the workplace or how they're supposed to be acting. Culture really sets the tone for the organization, and a positive culture can enhance employee well-being, and it can provide support to employees who may be experiencing mental health issues. Whereas a negative workplace culture can undermine the effectiveness of even the best programs, policies, and services intended to support the workforce. This also ties closely in with the next highlighted risk factor, civility and respect. So a civil and respectful workplace is related to greater job satisfaction, greater perceptions of fairness, improved morale and a more positive attitude, better teamwork relationships, and a reduction in turnover and sick leave. So a workplace that lacks civility and respect can lead to emotional exhaustion, greater conflicts, and job withdrawal or burnout. So a work environment that is uncivil and disrespectful Also, it exposes the organization to the threat of more grievances and legal risk. So, civility and respect may look a bit different to each of us. So that's why it's very beneficial to come together as a team and outline what civility and respect means for your organization. So this means, or could mean for your organization using respectful language like please and thank you. It could be as simple as saying hello at the start of your day. Being considerate and considering your audience before you speak, even if it's a joke and you don't intend to hurt someone's feelings. It could be including or being inclusive and including others in conversations, inviting them to lunch, or asking for their opinion. And then finally, and most importantly, respectfully intervening when you see inappropriate behavior. So actions and behaviors are contagious, and this unfortunately includes incivility. If one person is disrespectful or rude to another person, that person could take that negativity, pass it on to the next person, who can pass it on to the next person, etc., creating this spiral of incivility within the workplace. So we need to be able to recognize these uncivil behaviors, show empathy, and de-escalate the situation with kindness, which may include having some courageous conversations.
Clicker again. There we go. Was this the same clicker? That's a different clicker. That had me on the go for a minute. I was like, wait. Am I paying attention? As Ryan was just saying in the previous, this conference, this event that you're conducting, keeping it as simple as possible, right? And not trying to overcomplicate human interactions. Not an easy task, but it's all about de-escalation and linking back to kindness and compassion, which in a lot of industries and a lot of different sectors, that can be very challenging. We recognize that. But you're going to encounter throughout your personal and professional existence that there will be conflict. Like, they're guaranteed there will be differences of opinion, there will be ideals or practices that might not relate to every individual or group or team, as you're saying, Ryan, define what it is for your own workplace and do it proactively and do it in consultation with the worker and the employer, making sure that it really truly is a joint effort. I've experienced that gratefully in my own workplace because we established a Healthy Workplace Committee as early as 2013 when the national standard on occupation, the full standard on psychological health and safety in the workplace came out. So it's been almost a decade. And the work still goes on in every single workplace, trying to figure out how you can build upon this. And some of the advice on the slide, don't ever underestimate trust. If we have each other's back, if we're taking care of each other in a true and meaningful and purpose-built way, things could be better in a workplace. This is the hope. And I flash this up to say, quite honestly, we make contact. I'm like, how are you doing? How are you doing? You don't actually have to have that kind of training that folks like I have or others with psychological modalities and understand what's all in something called the diagnostic tool, the DSM-5, to be able to try and help somebody, right? You can just reach out in a meaningful, purposeful way and proactively. And active listening is a little bit more about what I'm about to chat about. You're going to ask questions, and we're going to ask the questions with the intention of receiving an answer. I have asked questions of people in my professional and personal life. We don't always get an answer right away. And having that level of patience to give people space, say they're more introverted, right? They're not as extroverted as I'm appearing to be right now. I'm kind of half and half. But I had a big learning styles talk with our team at work called Outreach, because we've added some folks to it. And I said, can we talk about how we work and how we learn? Can you describe what you think your style is? And it was really eye-opening for each individual, I believe. Do we even take the time to have those conversations? We're looking to reduce confusion, it says, because you're trying to understand where the person is at, where the situation is going. Like you're saying, reduce that contagion. Put the control in place by having meaningful and purposeful dialogue without judgment. That's really hard, right? because we all come with preconceived notions of things and unconscious bias and things that really could characterize us as not being open or willing to deal with what's going on. So giving that opportunity for that person to clarify or explain where things are at, really, really important. It's a structured way of listening. So you're listening, again, to anticipate their feedback and their response. You're not listening to then tell them what they're thinking, which is sometimes a reflex because you'd like to get through this awkward, perhaps intense conversation, depending on the nature or severity of what's going on. So it's really about your willingness. Are you willing, right? Are you going to make a commitment to listen when you're representing people, when you're working with your employers, when you're working with any form of committee or representation, period? Are you open to what's going on? Are you in it to problem solve together, right? Versus to have further conflict not be resolved. We're all about education, right? And so we brought the things, and we even provide tips that are really explicit on some of these cards, like the purple one I'm staring at here, you can see, that we give actual guidance to say how we can help our employers help the workers. And if you are in advocacy of the worker and you're in support of the employer, you would want to talk about this and model, right? And we're showing what goes up, you know, the increases in good things and the decreases in things that are dragging the workplace into the wrong, perhaps, realm, or other factors that might be affected. So we just want you to take hold of what is available, and it's really, really important, communication. So those tips, again, on the far orange and green list about tips for everyone, what Ryan was referring to, about connecting, right? And it, as appropriate as it is culturally, making very direct eye contact with people, or checking in with them to find out culturally if that's rude. Now that takes time and effort, right, to get to know your team. I was noticing in a team of, like, I'm the one as program person, but then there's 4 people I'm addressing. We had one of them remotely because they're recovering from illness, and they were wise enough not to come in and spread it around. I think we all kind of pick up on it. It could be flu, COVID, whatever it is. They took measures to join us, but in a healthy and safe way. So we're talking sort of to, like, their icon on the screen. I'm noticing other people not making full eye contact with me as they're talking more about where they're at. So having the patience for all that, we're here in that capacity too, to remind you that you have to have patience with yourself. Be self-aware. Where are you at before you enter that conversation, right? Because I'd like you to come back up and talk more, because I'm going to put it back to this. I'd like you to give some perspective too about the health and safety aspect again, Ryan. So we're almost there.
Okay, so I did mention some assessment tools when we were talking about the race model. These are some surveys that we offer through our Healthy Minds at Work portal, and each tool measures the psychological health and safety, but for different levels of the organization. So I don't need to go into too much detail about it, but the Psychologically Safe Teams Assessment, this is a brand new assessment tool. It's very exciting. It's for team leaders to see how their teams are doing across 3 categories, which would be leadership, team interactions, and inclusion. Then the Psychologically Safe Leader Assessment and Guarding Minds at Work have been recently updated in the last year. And the Safe Leader Assessment is for leaders to either use it as a self-assessment, or they can have a self-assessment and ask their team how they're doing on different leadership categories. And then Guarding Minds at Work, it's more at that organizational level, and it's requesting employees' perspectives about workplace factors that affect mental health. We also have the Stress Assess, which is partnered with OCOW for. You can do that as an individual, or you can do it as an organization. And then 2, caring for healthcare workers and caring for the paramedic community, which are very specific for those working groups. And if you have any more questions about them, I'd be happy to chat about it later. I'm part of the team that has been updating the top 3. So very familiar if you have any further questions. So on behalf of myself, Sue Freeman, and CCOHS, thank you so much for your time and attention today. We are here for a bit longer to answer any questions that you may have, but you can also email us at any time and check out our website. And as a shameless plug before I stop, I'm part of the inquiries team, so we do offer a confidential, free person-to-person inquiry service through our safety info line. So if you do have any questions afterwards as well, you can put those into the inquiry service, and health and safety specialists will answer your inquiry. So yeah, thank you so much, and now it's lunchtime, I believe. So.